So the language we use can be very powerful. And sadly, most of modern medicine has used terminology that sounds very threatening and increases fear. So these are fear-inspiring words. It's what you said and how you said it. So often we'll see on imaging words that sound really scary: ruptured, torn, herniated, bulging, ripped. Uh, but there's a concept that's called wrinkles on the inside. What does that mean? Well, when we think about wrinkles on the outside, wrinkles on our face that we get as we age, we know this is not a medical condition. This is not a disease process. It's just part of the aging process. Well, that same process happens under the skin. So many people who have no pain will have ruptured, torn, herniated, bulging, ripped structures that are seen on MRIs. And if we just think of the multiple studies that are done on the spinal discs and the spine and MRIs, it's been found that almost 40, almost 50% of people have a bulging disc but have no pain. They've found that the position we're in an MRI machine can change whether a disc is bulging or not. They found that sometimes the timing of the MRI may make a difference in whether a disc is interpreted as bulging or not. And why is that? Well, the discs of our spine are naturally more swollen, about 20% more swollen in the morning than in the afternoon. And here is a fact that I wish I knew when I was younger, and I try to help everybody understand that bulging discs will heal. It takes a while, but in about 2 months' time, a disc that is freshly bulging will have healed by 50%. And a disc is healed about 100% in about 9 months' time. Personally, I was told at 18 that I had a bulging disc, and I mistakenly believed, because nobody told me otherwise, that it had remained bulging for decades. And so I lived my life as if I had a bulging disc ready to burst. So I avoided. I was overprotective. And yet pain got worse and worse. But the reality is my bulging disc probably healed within that 9-month period. And these studies have been repeated with a variety of joints in the body. We reference here with the knees. This was an amazing statistic. About a third of college basketball players have no pain, but they have abnormal scans like torn meniscus. There are literally people born without an ACL, which is a very important ligament in the knee, which sidelines an athlete for a season, sometimes for a career. So some people are born without that ligament and don't even know it. They're fully functional. And here is a statistic that is fairly sobering. Only 50% of people with arthritis in their knee experience pain, meaning 50% with arthritis don't have pain. Now, so let's define arthritis. We're talking about osteoarthritis, which is a wear and tear of the cartilage at the end of our bone. So when you hear bone on bone. So once the cartilage starts to wear down, which is that cartilage is like a cap on the end of each bone. As it starts to wear down, you would be diagnosed with osteoarthritis or degenerative joint disease, DJD. So there are people, about half the people, who have DJD or OA, osteoarthritis, technically on the x-ray, but they don't have pain. So none of this says that your pain is invalid. It's all real pain. What we're just finding is what we blamed for the pain may not be what's causing the pain. Pain is so much more complex than just tissues that are injured. Pain has everything to do with the brain, everything to do with the nervous system, and something, sometimes very little, to do with the tissue that it's felt at. So what is the point? What does all this mean? Well, there's a concept called biological reserve. What does that mean? Well, We may have partially torn tendons, partially worn down cartilage, but our body can act normally. It can function fine because we have reserve. In fact, somebody who has a torn rotator cuff tendon, which is a muscle in the shoulder, small muscle, most surgeons will not operate unless it's more than 80% torn. Why? Because we can function very well with much of it torn in our shoulder. Biological reserve. I once saw an image which was fascinating of the canal in our spine where the nerve comes off of the spinal cord. And so it's called the foraminal canal, where the spinal nerve comes out of. And there's a lot of room where that nerve is. So sometimes you'll see on an MRI where it says the disc is bulging into the foraminal canal. And that sounds very scary because the nerve is in that canal. Well, isn't the disc going to compress the nerve? But there is a lot of room in that canal for both the nerve and some bulging of the disc. Again, biological reserve. And we have to touch on this idea of sham surgeries. Some studies have been done where they wanted to see how effective are these surgeries that we're doing, so particularly for orthopedic complaints. And many studies have shown that surgeries on the shoulder, on the spine, are just as effective. These, let's call them sham surgeries, are just as effective in pain relief as the actual procedure. And this is not saying that surgeries are totally wrong or shouldn't happen, but it's showing the powerful effect of the placebo effect, the brain, what it can do to relieve pain. So this is not saying that all orthopedic surgery should be stopped. It's just showing the power of what the brain can do when it believes it's been helped. So all these fear-inspiring words really stem from an old way of thinking, what's called a biomedical approach to healthcare, which basically looks at the human as a machine that has worn down parts that just simply needs to be replaced, just like bearings on a car. Let's just put new bearings in and things will work better. But humans are not machines. We are complicated living beings that have a tremendously sensitive and capable nervous system. And so simply replacing parts isn't the solution to all of our pain.